So this is the topic, and even though it's a very old concept, it still stands new and relevant. And this is my talk, to gravity of blindness in India. And this is to assess the gravity only, then only we can proceed how we can um, implement different methods to prevent that blindness. And this is well known to everybody. I need not explain the WHO definition for blindness. And since 2017 onwards, the blindness of this concept, world concept, is been accepted by the National Program for Prevention of Blindness also in India, NPCB. Before that, it was slightly different. And these are the different grading of blindness, how it is being graded. It's a fundamental. There's social blindness, legal blindness, and absolute blindness. Everything is there. And based on the visual acuity, this has been categorized. And towards my topic, this is existing prevalence is being assessed by various available surveys in India. And this is one old survey, ICMR survey 1971 to 74. And as per that survey, it was 1.38%. And then based on that, in 1976, we started National Program for Control of Blindness in India with the aim to reduce it from 1.38 to 0.3 by 2000. But now we are in 2023. And this is another survey, national survey by WHO NPCB 1986-89. And there also the prevalence was 1.46%. In the National Blindness Survey, this is the available latest survey on blindness in India. And that is, the prevalence is 0.36%. And I will just elaborate the last one or the latest one. And the whole population of India has been divided into two groups. The one which is 0 to 49 and above for 50 years. And the strategy was accepted by ICH. RAP means rapidly assessment, avoidable blindness, and International Committee for Eye Health, which has been approved by the WHO. And 31 districts of 24 states in India has been selected, and it was a house-to-house survey. And the total sample size was 93,000. That means a cross-section of India has been assessed to assess the blindness. And this was the aim to determine the prevalence of blindness and visual impairment, to identify the major causes of blindness and visual impairment, to estimate the cataract surgical coverage in India. So blindness as well, the prevalence of blindness and visual impairment also has been done in this survey. And just a few facts regarding that survey. The first one is, you can see that the lowest prevalence of blindness in India is in Kerala, Trichy only. And the largest one is in Bijano, that is in UP, a district in UP. So this is, we can definitely see that in Kerala, the incidence of blindness is comparatively less when compared with that of other states. And this is a district-wise prevalence of visual impairment. Here the Kerala stands third one, visual impairment. And this is about age-wise. You can see that 80 plus the incidence of blindness is more. And this is literacy-wise. You can see that the illiterate people are more blind. More illiterate, blind people more illiterate. And regarding rural and urban, in the rural area, the blindness, incidence of blindness is high. And assessing the cause of blindness, more than 50 years, and cataract stands first. That is 66.2% is due to cataract. And causes of visual impairment in more than 50 years, again cataract comes the first one. And now this is uncorrected refractive error, 11.5% is uncorrected refractive error, and this is 76.8% of patients or public population in India is uncorrected for presbyopia, not in Kerala, but the cross section of India. So this is cause of blindness in a 0 to 49 group, younger age group. This is the most common cause, non-trachomatous corneal opacity. And this is visual impairment 0 to 49 group, refractive error stands first. And you can assess the trend for the 2001 to 2019. And the incidence of blindness is coming down. And trends in prevalence of visual impairment also is coming down. And finally, this is my final one, the incidence of or the prevalence of blindness at present is 0.36%, and the visual impairment is 2.55%. That means we are in the correct way of, almost in the correct way of implementing the programs regarding visual impairment. Now we will have more deliberate, thank you.